Hello, my name is Deanna Ayers, and the infection that I chose to discuss with you all today in this presentation is cytomegalovirus infections. The physical and metabolic characteristics of CMV is that it has the largest and most complex herpes virus. It has a 235,000 double-stranded DNA genome. It is spherical in shape with isohedral symmetry, and the genome contains terminal and internal sequences. Has a long unique and a short unique region that are both flanked by inverted sequences. And on the right, the picture is CMV under a microscope. This is a picture of the CMV close up. As you can see the genome, the tegument, the nucleocapsid, and the two glycoproteins that will be discussed further on into the presentation. And here's another slide of the physical and metabolic characteristics. CMV is related to viruses that cause chickenpox, herpes simplex, and mononucleosis. CMV may cycle through periods when it lies dormant and then reactivates. If you are healthy, CMV mainly stays dormant. The human cytomegalovirus, or CMV, is a member of the family Herpes viralidae. It is known as a herpes virus 5. Multiple genetically distinct strains of CMV do exist. The differences in genotypes may be associated with the differences in virulence, and we'll get into the virulence later on. Infections with more than one strain of CMV is possible and has been observed in organ transplant recipients. Many patients who have CMV have different symptoms, and so today in this presentation, I have decided to split up the symptoms between babies, people who have weakened immune systems, and people who are healthy. For the symptoms of babies, most babies who have congenital CMV appear healthy at birth. The most common signs of premature birth: yellow skin and eyes, which is jaundice, purple skin splotches, enlarged spleen, seizures, hearing loss, low birth weight, enlarged and poorly functioning liver, abnormally small head, which is microencephaly, pneumonia, vision problems, and developmental delay. Most healthy people who are infected with CMV may experience no symptoms. Some experience minor symptoms. People who are likely to experience signs and symptoms include newborns who become infected with CMV before they are born, which is called congenital CMV. Infants who become infected during birth or shortly afterwards, which is perinatal CMV. And this group includes babies infected through breast milk. People who have weakened immune systems, such as those who have had organ, bone marrow, or stem cell transplant, or those who are infected with HIV, are also more likely to experience signs and symptoms. The symptoms of people with weakened immune systems or weakened immunity might experience serious problems including fever, shortness of breath, interstitial infiltrate, viral respiratory infections, pulmonary hemorrhage, recurrent lymphoma. CMV frequently is detected in the lungs of patients with HIV or AIDS, but usually represents viral shedding. For the symptoms of healthy adults, most people who are infected with HMV who are otherwise healthy experience few, if any, symptoms at all. When first infected, some adults may have symptoms similar to infectious mononucleosis, which includes fatigue, fever, sore throat, and muscle aches. The CMV infection can be transmitted in many ways. A few of these ways include touching your eyes or inside of your nose or mouth after coming into contact with the body fluids of an infected person, sexual contact with an infected person, the breast milk of an infected mother, organ, bone marrow, or stem cell transplantation of blood transfusions, or at birth. At birth, it's when an infected mother can pass the virus to her baby before or during. The risk of transmitting this virus to your baby is higher during your first time of pregnancy. When the virus is active in your body, you can pass the virus to others. The virus can be spread through body fluids, which includes blood, urine, saliva, breast milk, tears, semen, and vaginal fluids. Casual contact does not transmit CMV. CMV has many virulent factors. It shares many attributes with other herpes viruses, including genome, virion structure, and the ability to cause latent or persistent infections. CMV has an icosahedral protein capsid that consists of 162 hollow capsomeres, has an electron-dense core containing a double-stranded DNA genome with 230 nucleotides together, forming the nucleocapsid. It has an envelope that surrounds the nucleocapsid for protection, and spikes of viral glycoproteins which bind to specific host receptors and mediate virus entry. CMV has GB and GH, which are glycoproteins. GB is a major surface glycoprotein which influences binding and entry to cell-to-cell transmission. GH is a glycoprotein that targets complement-independent neutralizing antibodies. CMV also has tegument proteins which regulate host cell responses and initiate the temporal cascade. It also has immediate, early, and delayed genes to initiate viral genome replication. It also has late genes which initiate capsid assembly. CMV usually causes an asymptomatic infection. It remains latent throughout life and may reactivate. The symptomatic diseases usually manifest as a mononucleosis syndrome, which was first described in adults in 1965. Clinically significant CMV disease, which is reactivation of previously latent infection or newly acquired infection, frequently develops in patients immunocompromised by HIV infection, solid organ transplantation, or bone marrow transplantation, as well as in those receiving high-dose steroids or other immunosuppressive medications. In patients co-infected with HIV, CMV infection leads to progression to AIDS and eventually death. Symptomatic CMV disease in individuals can affect almost every organ in the body. When the host is infected, CMV DNA can be detected with polymerase chain reaction, or CPR, in all of the different lineages of organ systems in the body. Upon initial infection, CMV infects the epithelial cells of the salivary gland, resulting in the persistent infection and viral shedding. Despite ongoing viral replication in the kidney, renal dysfunction is rare, except in renal transplant recipients, in whom CMV is associated with rare cases of possible graft infections. CMV can be diagnosed in many ways, such as in specimens, which includes urine, saline, tissue, biopsies, and bodily fluids. It can also be diagnosed using virus isolation, which is where the CMV produces a typical focal cytopathic effect that can be found in the human embryo of lung fibroblasts. It can be found during microscopy, which you can see virions in the urine of infants. It can be found using the cytopathology, which is where intracellular inclusions can be recognized from biopsy material by the typical owl's eye appearance. It can also be found in the tissue immunofluorescence. It's when the infected lung and liver cells are stained by specific anti-CMV antibodies. The other diagnosis methods include antigen detection and serology. Antigen detection detects the CMV pp65 antigen in leukocytes by using the pp65 assay. Serology determines the CMV presence or absence in CMV IgG by ELISA for indirect hemagglutination. Careful hygiene is the best prevention against CMV. You should always wash your hands often, avoid contact with tears and saliva when you kiss a child, avoid sharing food and drinking out of the same glass as others, be careful with disposable items, clean toys and countertops, and practice safe sex. Isolation of newborns with generalized CMV inclusion disease from other newborns is advisable. Screening of transplant donors and recipients for CMV antibody. There is no cure, but there are a few medications that can help to treat the symptoms of CMV, and they are listed below.